Hi guys, welcome back to my channel that is Exam Ready Nursing. So आज का हमारा टॉपिक है recurrent abortion. Recurrent miscarriage refers to the occurrence of 3 or more consecutive spontaneous abortions happening before 20 weeks of gestation. Recurrent miscarriage का मतलब होता है कि वुमेन को 3 या 3 से ज़्यादा स्पॉन्टेनियस मिसकैरेजेस हो रहे हैं और वो भी बिफोर 20th वीक्स ऑफ जेस्टेशन. उसको हम रिकरेंट मिसकैरेजेस कहते हैं. नाउ लेट्स सी द इटियोलॉजिकल फैक्टर्स. इसकी क्या इटियोलॉजिकल फैक्टर्स हैं? ड्यूरिंग फर्स्ट ट्राइमेस्टर में अगर जेनेटिक एबनॉर्मैलिटीज़ हैं, एंडोक्राइन और मेटाबॉलिक डिसऑर्डर्स हैं, वुमेन को इन्फेक्शन हुआ है, इनहेरिटेड थ्रोम्बोफीलिया है. अगर इनहेरिटेड थ्रोम्बोफीलिया है, थ्रोम्बोफीलिया में क्या होता है? ब्लड क्लॉट करने लगता है. तो अगर क्लॉटिंग प्रॉब्लम है तो उसकी वजह से इंट्रावेस्कुलर कोएगुलेशन हो सकता है. बिकॉज फॉर एग्जांपल अगर डेफिशिएंसी ऑफ प्रोटीन है या डेफिशिएंसी ऑफ विटामिन सी है या नेचुरल एंटी कोएगुलेंट बॉडी में उनका डेफिशिएंसी है तो उस वजह से मिसकैरेज हो सकता है. देन इम्यूनोलॉजिकल फैक्टर्स भी होते हैं कुछ, लाइक ऑटो इम्यून रिएक्शंस, some alloimmune reactions. Now what are the autoimmune reaction? Autoimmune reaction means when body's own defense system start killing our own cells. And alloimmune में आ जाएगा कि अगर कोई जो आउटर सेल्स हैं उनके अगेंस्ट हमारा डिफेंस सिस्टम उनको फाइट करता है और किल करने की कोशिश करता है. फॉर एग्जांपल अगर आप ब्लड ट्रांसफ्यूजन कर रहे हैं, ब्लड ट्रांसफ्यूजन में अगर रिएक्शंस हो रहे हैं, बॉडी इम्यूनोलॉजिकल रिस्पॉन्स दे रही है, सो दैट्स द एलोइम्यून रिएक्शंस. देन उसके बाद देयर आर सम अनएक्सप्लेन्ड कॉजेस which cannot be explained and recurrent miscarriages occurs. Etiological factors are related to second trimester. So in second trimester the first thing is cervical incompetence. Then Mullerian duct anomalies का होना, which are by birth these defects are present. For example, the girl is having double uterus or bicornuate uterus or septate uterus का होना. So these are the Mullerian duct anomalies which can be related to the recurrent miscarriages. Then due to uterine fibroid, miscarriage can happen. Due to retroverted uterus, chronic maternal diseases can be a cause. Then infections or some unexplained causes can be there for recurrent miscarriages to occur. Now, how to diagnose? What are the diagnostic tests which we perform? So the first is blood investigations are done. Blood investigations include blood glucose level checking, then VDRL, thyroid function test is being done, then determination of ABO and RH blood groups. Ultrasonography is being done. Then hysterosalpingography can be done to evaluate the uterine and tubal structures to find out any blockage or anything. Then hysteroscopy or laparoscopy for direct visualization of reproductive organs that can be done. Then endocervical swab can be taken to detect the type of infection woman is suffering from. So these were the diagnostic investigations. Now we come to the treatment. Treatment during interconceptional period. What we can do? So help the woman to reduce anxiety and promote psychological well-being of the woman. Then perform hysteroscopy we can perform for removing the uterine septum. If the septum is present, then hysteroscopic examination can be done and further the things are done. Then carry out uterine unification surgery for the cases if the woman is having bicornuate uterus. Then provide genetic counseling if there is presence of any chromosomal abnormalities. Manage and correct any endocrine disorders if they are present. Treat the existing genital tract infections effectively. Now, what is the care which we can provide during the pregnancy? During pregnancy, we should provide reassurance and compassionate care to the woman. Then conduct regular ultrasound examinations. Ensure the mother gets sufficient rest. Advise against heavy or strenuous physical activities. Restrict sexual intercourse if medically indicated. Limit or avoid unnecessary traveling. And during luteal phase, if the woman is having luteal phase defect, so in case of corpus luteal insufficiency, what can be done? Progesterone 100 mg is given as a vaginal suppository 3 times daily, starting 2 days after the ovulation. If the pregnancy test becomes positive, the treatment is continued up to the 12 weeks of pregnancy. Then, in case of inherited thrombophilia, antithrombotic therapy is sometimes used to improve the pregnancy outcome under strict medical supervision. This typically involves the administration of anticoagulant medications for a duration determined by a healthcare provider only. For any medical complications, specific treatment should be continued according to professional guidelines. And if there are unexplained causes, supportive therapy and close monitoring that can enhance the chances of successful pregnancy. Comes cervical cerclage operation. This is a surgical procedure where a suture is used to provide support to the cervix. This procedure is typically performed by specialists during early stages of pregnancy to help prevent premature birth or pregnancy loss in individual with a history of cervical insufficiency. So these were the treatment modalities which can be used to prevent recurrent miscarriages. I hope आपको ये short video समझ में आया होगा. You can comment me if you want the written notes and tell me in the comment section how did you like this video. Thanks for watching. Goodbye.